In January, as of 20th of January 2025, we recorded the first case of cholera in our district, and within a few days the number kept on escalating at an alarming stage. We were really grateful to have Red Cross who responded within a day. As a district, we recorded 235 cholera cases, and out of that we recorded 6 community deaths. We received a lot of support from Red Cross, who provided us with chlorine, both granular and liquid chlorine, as well as supporting our staffs in terms of our community-based volunteers who went on the ground to be sensitizing people. Cholera came in with a lot of challenges in terms of financial as well as human resource. But with Red Cross, they took us as their own. They gave us a lot of technical support in terms of financial as well as human resource. And this made our work to feel a little bit much easier. And the fatality case was so low because people were made aware of the situation.
Anachinja kuza pana tusha na mumani ani sote time na sambu so pakati sana huko samba deni na samba kufio kuno kuchita chida samba anachifiki na anachinja na chinja na sana
who even up to now they are doing sensitization in the community as well as distributing chlorine. Apart from that, they have been sponsoring us, supporting us in terms of radio interviews. Since we are just few months from the rain season, we don't want to experience the same situation which we experienced. We would urge and plead with Red Cross to continue supporting us. I would really thank Red Cross for the support they rendered to us. The other challenge which we really had and we are still having is the shallow wells. Kasumbalesa alone has over 3,600 shallow wells. But with these bores which has been sunk, the shallow wells has to be buried.
Our community was supported by Red Cross of Zambia, where they trained 30 community volunteers with information which they were taking into the community to educate them on the prevention of cholera. Red Cross supported facilities in Chingola, Chawama, Chwembala. They also supported Lulamba, Kabundi and King's Health Post. The facilities were also supplied with hand washing soap. They were also supplied with hand sanitizer, IEC materials, and the community volunteers were distributing the hand washing soap door to door. All the communities which were well supplied with information, they were also using that information to help them in the prevention of cholera.
Kuna twalitotera pakusambirisha kusoma ba Red Cross twashire tusambirisha pakuchinangu uyu mwaka infle ya laisa twale wompya bwino chlorine twale isunga bwino twale womba bwino tule wompya bwino ifshala pakuchitwika lwala ko cholera ngafira uyu mwaka abantu balwere sana cholera kuno kuchingo.
Our community volunteers who have been going around sensitizing the community, we are so grateful for this move because looking at the period where we are about to face the rain season very soon. Our community is prepared even before the rain season starts. So if we could have at least a lot of community volunteers trained.
You will recall that we had 600 cases in the last year and we lost 16 people from cholera. And Red Cross came in to work with the district. We did a number of interventions together. Number one is we ensured that our frontline health volunteers were trained, and we also oriented our health workers This gave us the impetus to be able to go into the homes, especially in the high-risk areas. What we were doing is door-to-door campaigns, discussing the dangers of cholera. During these visits, we also took advantage to distribute chlorine. And on top of that, I want to say that our partner, Red Cross Society, working with other stakeholders, ensured that resources were available such that our high-risk areas, in addition to the information we're giving to the communities, were able to provide safe water sources. So we did a number of ablution blocks in our health posts and health centers. We dug a number of boreholes. I think a total of 16 projects were carried out to ensure that our communities, as they come to the facilities, they are using safe water. You'll be glad to note that the last two quarters starting from January to date, we have recorded the least number of diarrheal cases for both children under 5 and the children and the adults. So I want to thank Red Cross for embarking on such human-oriented, life-saving interventions.
Kufintu mumwene kunu moku ba Red Cross na batu bafuija kuna boho muno mu community yesu ya bulangiriro pano pa facility pa bulangiriro pali boho abantu balaba shikwete amenja ya afikapo nango banda chlorine tapali na bakwata ensambusha kusamukutapa pano pa facility pa bulangiriro.
So our first cholera case was recorded in December of 2024, and we closed our outbreak in February of 2025. And this outbreak was a far cry from our previous outbreak, where in 2023 where we recorded over 1,000 cases. And I think one of the reasons for this is because of our great collaboration with one of our partners, which is the International World Red Cross Organization. In this collaboration, we have seen an increase in the amount of sensitization and information that our community actually has vis-a-vis cholera. Together with the Red Cross, we have managed to train 104 community volunteers, and these individuals have provided a wealth of information to the hotspot communities in Ndola district. There have been a number of wash points dotted around the communities in Ndola. We also have the setting up of oral rehydration points within the communities. The fact that we have volunteers in the community who are in contact with our surveillance teams puts in another dimension to ensuring that surveillance is on point, and information on where there are lots of diarrheal cases present can actually be transmitted quickly to the district, and the rapid response team can then be dispatched and quickly return and monitor. The community also has a heightened sense of alertness to the fact that cholera can become a big problem. And as such, they are more wary, and they are taking matters into their own hands to ensure that they have safe water, they dispose of their waste in a hygienic manner, and that they actually report cases of diarrhea.
Barisa tuletera kosopo ya kusambira kuminwe na chlorine na ORS ba Red Cross aho baretu wafwa sana tulete mwa kwati kuti batwalirira okuchitechi mlando wakwati ngatabaliko imyeweshingi kuti shaloba.
In the first quarter and second quarter of 2025, we had the cholera outbreak, and through that period, we recorded a total number of 121 cases. We didn't have any mortalities, despite some of the cases were tending to be critical. Earlier on in the outbreak, we had implemented a multi-sectorial approach, and one of our key partners, Zambia Red Cross, came on board to support. So they helped strengthen all the key pillars of the cholera response: case management, WASH, RCCE, and that effective approach enabled us to end the cholera outbreak. We didn't record any death, we didn't record both facility and community, so they really helped us, even with commodities such as chlorine and other commodities that helped us improve our WASH. Key challenges that the district is facing, as usual, we don't have a designated isolation center. Despite have a place, the structure that's there is still in a dilapidated state. Still have the challenge of people relying on shallow wells in some parts of the district. I really want to thank the Red Cross team for the support that they have continued to provide to our district. And we look forward to collaborating more in future. What we've learned is a multi-sectorial approach is actually key. We are now seeing the coming of Mpox. As a district, I should mention that we recorded 2 cases of Mpox. Right now, the epicenter is Mukushi, which is also near Kabwe. So we are really grateful for the support.
nalikwete problemu ya mwana wabili kolera so pa first nshaishi bati nikolera nalema nafyo mwana ali diarrhea no kuluka so fyo kwa ishile isaba Red Cross baisa tusambilishe fya kuchita asenda no mwana bamuchita bwino bamutangata atupera nefya kubonfya bali tupera ko ka dish ka bucket hand sanitizer fya kubonfya ku toilet no mwana epo alifya bwino no kupola adipola.
Zambia Red Cross Society, in collaboration with Ministry of Health and other partners, provided relevant and effective responses. Communities and partners have testified that the various initiatives employed were meaningful and have saved many lives. With the onset of the coming rainy season, social and behavioral change is expected to reach a new level, driven by the preventative measures, messages, and trainings conducted by Zambia Red Cross Society. This is a production of Zambia Red Cross Society Media.